Hello, I'm Alan Barclay from Diagnostic Imaging Europe, and I'm with Professor Thomas Kroencke of Augsburg, Germany, who's just chaired very interesting session sponsored by Barclay on the implications of photon counting CT. The introduction of photon counting CT was heralded by a rare comment from the FDA that this represented, photon counting CT represented the most major advance in CT for 10 years. Quite an extraordinary comment. Do you agree?
Yes, I do. I think it's really resonating in what we see with working with a machine, that it is really not an incremental improvement, but rather a really profound change in how we do computer tomography.
The advantages of photon counting CT include increased spatial resolution, decreased dose, and the possibility of spectral imaging. In your opinion, which is the most important of these advantages?
Actually, the combination of ultra-high resolution and spectral imaging is most important to me. And I think we will see this more in use in the coming months and years, because people now try these kind of combined possibilities in the coronaries, for example, to characterize plaques, to have a better understanding of narrowing of vessels like and stents within coronaries. And this is really fascinating. And the combination, as I said, ultra-high resolution and characterization, there is, I think, the key.
What are the implications of all this in regard to contrast media?
Actually, my first answer would be maybe we need less contrast, which is indeed the case. But we haven't investigated all the uses of contrast agents and iodine contrast in the functional assessment of the heart. So looking at late enhancement, looking at the functionality of the heart, iodine might play a different role than we have looked at it in the past. So for normal CT angiography, the question is clear, we need less, that's true. But for functionality of the heart examples, for example, we might see some different approaches and see different concentration, different delivery rates, etc. And this still needs to be investigated.
So all in all, a really exciting area to be in, one with a lot of potential.
That's true. I think there couldn't be more excitement than now. So we see it exploring, we see that people open up new doors, how we look at computer tomography, how we image patients. And you're right, it's exciting times, that's true.
That's a great note to end on. Thank you very much, Professor Kroencke.
Thank you.